and welcome to our second webinar on supporting participation and inclusion. In this session, we will focus on applying a person-centred approach to minimise behaviours of concern, reviewing the context of the behaviour of concern, providing positive behaviour support according to an individualised behaviour support plan, and completing documentation. We're going to begin this session with talking about promoting a person-centred approach. When working in disability, aged care, or community services, your clients will have a range of dependencies over their daily activities. This will depend on their living arrangements. For example, they may be living in an aged care facility, a group home, with their family, or independently within the community. They may have total control over their routines, some control, or need to be assisted in almost every area of their lives. Our routine provides your client with stability, predictability, and safety. There are a number of ways you can help your client to maintain their daily routines. Wherever possible, your client should be encouraged to be involved within their daily routine. You should try and support their goals, hopes, and aspirations for now and for the future. These goals might be something as simple as them making their own breakfast, through to catching public transport, studying, or finding employment. Your organisation will have its own policies and procedures to support both you and your client to manage their daily routine. It's essential you understand and work within your organisation's policies and procedures when managing your client's routine. Working in the community, age, or disability sector, an employee can usually expect to work with individuals who come from marginalised or disadvantaged backgrounds, and in some cases, violent backgrounds. These clients may come from a range of backgrounds and have a history or mental health issue, alcohol or substance abuse, physical or mental abuse, and chronic health conditions. Many of your clients will have individualised care plans or an individualised action plan for these kind of situations. As many of your clients have experienced unpredictability and often unsafe environments in the past, it's integral that you keep your routine interactions and actions with your client as safe and as predictable as possible. So, how can you do this? You can do this by ensuring you're on time for any appointments or meetings with the client. This will foster their trust. You can do this also by ensuring, where possible and practical, you alert your client of any changes to appointments and meetings well ahead of time. You should ensure your work environment, external activities, and client visits are compliant with relevant work health and safety requirements. You need to consult with your client, and you may need to engage work health and safety consultants to ensure their home is safe, not only for them, but for you and any other members of the organisation who will be required to go into their home. And you also need to identify, report, and rectify any unsafe situations, equipment, or instances at the first available opportunity. This could be as simple as reporting a chair in your office as broken, through to notifying your organisation of an unsafe vehicle or an unsafe piece of equipment. And finally, be prepared for any interactions with your client. This means having followed up on previous meetings, be prepared for any issues the clients may bring up, and any discussion points or any concerns that you may have. This will help foster a safe emotional environment for your client. In some cases, your client may display inappropriate behaviours that can endanger themselves, you, other clients, and other members of staff and members of the community. These behaviours may include inappropriate sexual behaviours, such as public masturbation or making sexually inappropriate comments, violent or inappropriate physical behaviours, such as aggression towards others, yelling or screaming, destruction of property, and not undertaking tasks in a safe manner, such as kitchen tasks or workplace activities. You're required to develop positive, predictable strategies that will keep the client safe if they are exhibiting inappropriate behaviours. This may include distracting the client. If they are exhibiting inappropriate behaviours and redirecting them in a positive or appropriate manner. Engaging another staff member, having a clear action plan developed in consultation with the client's family, treating medical practitioners and specialists. By reinforcing predictable and positive responses to inappropriate behaviour, you will help foster an environment that encourages the client to display and model appropriate behaviours. This creates a safer, predictable environment for the client and for you to interact. Working in the disability, aged and community sectors, you may come across clients who on occasion display disruptive or even violent behaviours. Behaviours that are likely to put a client at risk may involve aggressive behaviours towards themselves or others, acting in an unsafe manner or against instruction, and undertaking activities in an unsupervised, unsafe manner. When any type of aggression, violence, or disruptive behaviour occurs, it must be documented in the client's file as soon as possible and in line with the organisation's policies and procedures. Many organisations will have an incident report form that should also be used whenever a client is displaying these types of behaviours. An incident report typically has information such as the client's name, date of birth and address, the location or locations of the incident, the actual behaviour that you observed the client display, if the client was hurt during the incident and what injuries the client sustained, if any other person was hurt during the incident and what injuries they sustained, if there were any identifiable triggers to the event. This may include a loud noise, an unfamiliar environment, or occurrence. Also, the incident report will include how the client was managed during the episode, such as diversion tactics or self-relaxation techniques. If any third parties or referrals were made, this also needs to be written within the incident report. Any first aid that was administered to the client, post-event treatment for the client and any people involved, such as counselling or debriefing, and other observations that have been made around the event, such as the client has had a change in their medication or a change in routine that may have affected their behaviour. If this behaviour is ongoing, these reports will provide valuable insight into possible triggers, warning signs, or danger points that may predict that the client's behaviour is beginning to escalate. When trends can be identified, measures can be put in place to mitigate or to prevent these episodes. Any trends can be documented in the client's individualised plan to prevent future events from occurring. Your client may have very predictable responses to environmental cues or react in a very unpredictable way when presented within the same environment. Environmental factors can often bring unpredictable situations, many of which can be or are unavoidable. You may find trends, however, that allow you to mitigate or lessen the impact of the environmental factors of a client's behaviour. You may note that the client sometimes displays risky behaviour whilst they're out in the shopping centre. However, this seems to be less notable when there are not as many people in the shopping centre, such as on a weekday, as opposed to the weekend. There may be environmental factors as simple as if the client has had a good night's sleep the night before, then their behaviour might not be as bad the following day. For these reasons, it's integral that your incident reports and daily interaction notes with the clients document the severity of their risky behaviour and any foreseeable environmental impacts and mitigation practices you employed to reduce the impacts of these behaviour are also documented. When we're looking at behaviours, we need to consider the client's emotional well-being, physical well-being, and the client's medication. Their emotional well-being is important because emotional well-being is important to everyone. An emotional strain can place stress on almost everybody, and without the skills to manage and deal with emotional strain, some clients may react in a negative or risky way. Some sources of emotional frustration can include a difficult situation or interaction in the client's home, the aged care facility, or with an activity they're involved in, a sense of tension within the family, lack of sleep, unmanaged pain, a change in a carer, caseworker, or member of staff, or a feeling of helplessness within the treatment and recovery process. In situations where your client may not be able to articulate their emotional concerns, it may be appropriate to seek further information on a client's mental state from other carers, the client's family, or other people involved in treating the client. Even informal conversations with one of these people may uncover significant and helpful information that can assist in managing a client's risky behaviour. We also need to consider our client's physical health and well-being, as this also impacts on every individual. An injury can lead a person to frustration, anger, boredom, and even a sense of helplessness. A person that's coupled with pain, poor physical health, or injury can produce undesirable or risky behaviours. Another thing we need to consider is the use of medication when it comes to our client's behaviour. Similar to health issues or health concerns, a client's medication may have an impact on their behaviour. Whilst a client's medication may influence their behaviour, a client not taking prescribed medication may also have a negative impact on their behaviour. Please report any changes in a client's behaviour to your supervisor and document this information within the client's progress notes. For clients that have a history of a challenging behaviour, they will have a behaviour management care plan in place. Let's now look at our client, Mi Wan. You should have received Mi's leisure and health care plan in one of the earlier workshops, so you can get that out now for your reference. Otherwise, we'll have a look at her behaviour care plan. We're now going to look at a behavioural care plan for Mi Wan, and this is a physical aggression care plan. Mi Wan, so she lives in room 18, born in 1925. She's got a medical history of advanced Alzheimer's disease. So when you see these behaviour management care plans, you'll see that there is a table that has an issue, potential triggers, goals and interventions. So let's look through these when it comes to our client Mi Wan. The issue for Mi Wan is that she's hitting out at staff during ADLs, which are known as activities of daily living, and also during activities. The potential triggers are loud noises and overstimulation from too many people being in the room at one time. The goal for Mi Wan is to reduce Mi Wan's physical aggression and to promote Mi's safety and to prevent Mi or staff from injury. So, when it gets to a point where it seems that Mi Wan is getting unsettled and starting to get a little agitated before she actually becomes physically aggressive and starts hitting out at staff, we want to trial some of these interventions. The first one is we can move Mi Wan to a quiet environment. We can stop the activities or the activities of daily living that Mi Wan's involved in. We can try the Paro robot seal, which is basically it's a robot seal. It can be given to Mi Wan in the early afternoon as she's appearing to get agitated, and it can sit there on her lap and Mi Wan can pat and stroke it. The Parrot robot seal can be used as a calming agent for Mi Wan. So that just shows you an example of how a behaviour management care plan will be set up. So it's important to familiarise yourself with these behaviour management care plans for any clients that have history of behaviours. You may find that in your work role, there'll be people with challenging behaviours that may make you feel uncomfortable. A behaviour of concern is any behaviour which causes stress, worry, the risk of or actual harm to the person, their carers, staff, family members or those around them. The behaviour deserves consideration and investigation, as it's an obstacle in achieving the best quality of life for the client, and it can present as an occupational health and safety concern for staff. So let's now look at some of the common behaviours of concern. These can be things such as a client raising their voice or an angry tone, using threatening language, screaming, damaging property or throwing things. Physical aggression such as hitting, kicking or spitting. Of course, there'll be many more behaviours of concern to add to this list. This is just a small sample of some of the common ones you may come across. If a client demonstrates a behaviour of concern, you can quickly perform a risk assessment that will get you on your way to deciding the most appropriate response to this client's behaviour. So you need to assess the risk. Is anyone in danger? You need to leave the situation if possible and remove others from the situation to prevent someone from getting hurt. You need to decrease stimuli for the person if you believe that is something that's upsetting them. And if the behaviour continues, you will need to escalate the crisis according to the organisation's policies and procedures. This may mean that you may need to contact supervisors or emergency services. Now look at the process of using positive behavioural support when it comes to managing challenging behaviours. Positive behavioural support is based on decreasing the behaviours of concern and improving the person's quality of life. Positive behaviour support tells us the best way to work with an individual who shows behaviours of concern and gives us ways to improve the quality of life for the person, and it doesn't just deal with the behaviour. This approach places an emphasis on the need for responsiveness to a person's feelings and needs, and it has the following defining features: valuing the person, deliberately building a sense of worth, and acknowledging positive interactions, creating situations where the person is placed at their best advantage, acknowledging and trying to interpret what the person is communicating via their behaviour, analysing the functions of the behaviour, teaching the client other ways to meet their needs or to communicate their feelings, gently supporting and leading the client to become calmer, and providing encouragement and feedback about difficult situations the clients may have actually handled well. Some possible consequences and outcomes of the consistent implementation of positive behaviour support strategies are that the person may learn that their feelings will be noticed and acknowledged, where and when behaviours are appropriate and valued, how to manage situations and emotions that have previously led to difficult situations, that considerate and cooperative behaviour is acknowledged and it gets things achieved, leads to good feelings, and that they can make a difference by influencing others in a way that's mutually pleasing. When we know what behaviours are, we need to gather as much information as possible about the behaviours. We need to know what happens before the behaviour. We need to know what happens during the behaviour and what happens after the behaviour. By doing this, we will be able to uncover patterns in the behaviour. So, we need to have a look at any events, triggers or warning signs. It is important to consider possible background factors, such as what is happening in the environment, where did the behaviour occur, and who was there at the time that the behaviour occurred. Once a trigger is recognised, it's important that the trigger is decreased or eliminated if possible. I can't stress to you the importance of identifying what the trigger is for the client's behaviour, so that a strategy can be put in place to manage that client's behaviour. Without knowing what the trigger is, it's very difficult to put any kind of effective strategy in place. Let's now look at some strategies that can be used around some examples of triggers. So, a sample trigger. Bob becomes agitated when he's in a noisy environment. What would be an intervention? We could suggest to Bob that he move to a quiet area, and we can spend one-on-one time with Bob to calm him down. Rosie starts yelling at staff when she sat across the table from Jessie. Offer to Rosie to sit into another seat or onto another table if it's Jessie that's upsetting her. Jack attempts to run off, abscond, from the group on a morning walk, stating he wants to go home. The interventions around this should start with a risk assessment. This would need to be completed to determine if Jack is safe to attend ongoing walks or not. Another situation. Elsie becomes unsettled, crying and banging on the door at 4 p.m. This is known as sundowning. She is saying that she wants to go home to her children. We could try distracting Elsie by giving her a task that makes her feel important and helpful, such as assisting to fold napkins or setting the table ready for dinner. A client's behavioural management care plan should be regularly reviewed to ensure that it remains current and the strategies that are in place are still effective. If the strategies are no longer effective, this should be discussed with your supervisor so a behaviour assessment can be completed and the behavioural management care plan can be reviewed and updated. If a client displays a new behaviour or interventions are no longer effective at managing the behaviour, a behaviour assessment needs to be completed. Let's look at the steps in completing a behaviour assessment. Step 1. Define the behaviour of concern. You need to write down the behaviour in a way that the actual behaviour of concern can be easily understood by others and that it can be used to gain reliable information on and when it occurs. Step 2. Find out as much information as possible about the behaviour. What happens before the behaviour? What happens during the behaviour? And what happens after the behaviour? Step 3. Come up with an idea about why the behaviour is occurring. That is, what is the purpose or function? Does the behaviour appear to be serving for the person? Some of the most common reasons why behaviours of concern occur include gaining social interaction, escape or avoidance of demands, gaining access to preferred activities, sensory feedback, pursuit of power or control over one's own life, and anxiety. Step 4. Test your idea or your hypothesis by introducing strategies such as environmental changes, skill development strategies, and planned responses to the behaviour. These strategies must be linked to why the client is using the behaviour. The introduction and consistent implementation of these strategies should result in a reduction of the frequency and intensity of the targeted behaviour over time, and therefore increase the individual's quality of life. Step 5. Regularly monitor, evaluate and review the effectiveness of these strategies. Think about what worked and what will need to be changed. Ongoing data collection will be required to monitor or check that your ideas about the behaviour and the strategies are still current and working. In some situations, our clients will need to be referred to allied health professionals to assist in managing behaviours of concern. All organisations will have policies and procedures relating to referring clients. The referrals to allied health professionals could include a referral to the client's GP, a counsellor, psychologist or psychiatrist, or a specialist, such as DBMAS. Have you heard of what DBMAS is? DBMAS stands for Dementia Behaviour Management Advisory Service, and we'll look at that in a little bit more detail in a moment. But before you refer any clients for further assistance, you must always check with your supervisor. They will have the authority that you need to refer and probably a list of preferred specialists to refer to, along with their contact details. So let's now look at what DBMAS is in more detail. It's a national free service funded by the Australian Government, and it's operated in and administered by the Dementia Support Australia. They provide individualised support for the carers of people living with dementia, whose behavioural and psychological needs are rapidly changing and impacting on the person's care and quality of life. Their clients are people living with dementia, care workers, health professionals and family carers who are supporting a person with dementia and behavioural and psychological changes. These changes can reduce the quality of life and can be stressing both for the person and the carer. DBMAS can be called for further advice, or you can visit their website. If you've got an issue or a challenging behaviour your client is displaying, with permission from your supervisor, sometimes a quick phone call to DBMAS is a great idea. They can give you ideas and strategies that you could try to implement to manage your client's behaviour and improve their quality of life. I've previously used their services numerous times and found them very useful. Thank you for your participation in this webinar. Continue now by watching this video from DB Mass.